Wow.
God. Wow.
Okay.
Oh my gosh.
That's...
Poor fella.
So we're here with our little gator that we just picked up last night. We got home at 2 a.m. with this thing, and this is the one that got shot. It's got looks like crossbow bolt right through here, and another one entered in right through here in the photo, but we don't see anything now. So not sure what's going on in there. That one obvious, very obvious. And he's got a lot of older injuries too. Right here is an injury that looks old and healed. This is definitely an old healed injury too. He appears to be completely blind. And then also he's got quite a few older injuries on the tail too that all look like they are from another alligator. But these ones up here is just somebody being an a-hole and shooting this poor thing with a crossbow. Looks like only one nostril is functional right now too. So since we got him 2 a.m. last night, been on the phone all morning trying to figure it out, and thankfully our friends Kim and Charles right over here were able to hook us up with Dr. Andrew, the Nomad Vet, on Instagram. Oh, this little guy still got a lot of fight in him. And so we're gonna try to do a workup on this poor little gator, do some x-rays, and work from there and figure out what we can do to help this poor thing out, because man, he's gotta be suffering pretty hard right now. Hold him tight, you mean?
Yeah, just hold him tight. Yeah, like I'm gonna get real close, probably within 4 or 5 inches. See anything in the back of the eye there. There's some serious trauma. So generally when we use the ophthalmoscope, we can see like kind of the anterior structures in the eye, blood vessels, cornea, even the optic nerve. But with him, there's nothing. So nothing visible.
I don't even see the pupil.
Yeah. I think there's been some serious intraocular trauma. So, but we can compare it to the other side. Third eyelid elevated. Okay. Right here. I think that arrow
Entered in right there.
Yeah. Let's see, might be arch ears. Yeah, there's something right there. I don't know if you can appreciate that here. It's nice and smooth.
Yeah, right there.
Right there, yeah.
I think that's it. You can see some discharge.
Yeah, so it could be part of the arrow that was there. It could be a bony structure that came off as a result. We'll get a better understanding with the radiographs. I can move his arm too if you want to get the head.
What do you think of that not working?
Yeah, it's pretty stenotic. It's pretty close up.
Well, if anything entered into the sinus cavity, it could be causing a block, especially if that one.
Yeah, because they can control it, so it could be a pain reaction. You know, he's like holding it closed as a result of that.
Just to the side.
All right.
Are we ready to put him in?
Or they might just both look good. Yeah, I think we're good.
So we're at about 12K.
12 kicks?
Yeah, so about 25.
Okay.
25 pounds. Does that seem right? 25?
Yeah, we were saying 30, so.
Yeah, yeah. So.
So now Dr. Kushnir is administering an anti-inflammatory to try to help out with the inflammation, especially worried around the brain from the arrowhead.
Put his head within this light frame in whatever direction works.
You need to raise the plate up a little bit so it looks like kind of on a slope compared to the beam.
Is that a little better? Because it might just be this needing to be adjusted too.
Yeah. Can we get him farther up on the plate?
Slide him up a little more so we can get his full head in there.
Yeah, maybe even the neck a little bit.
There?
Maybe a little more if we can. Yeah, that's great. Oh, well, big surprise.
Oh, he got shot with a shotgun.
Yep, these are all pellets.
Okay, so
He's got multiple, so he's got one where he's got two there, and then, of course, all this scatter here. This is the arrow, which...
okay, no, this is the arrow sticking out.
Yeah.
So this is the other arrow that entered in at the ear.
And we could see it sticking past the throat, right?
Yeah.
That's the part we're seeing, yeah. When we're...
I totally messed up on my video skills, but yeah, so this is the arrow sticking out, and then
Right,
this is the one that...
top.
Yep, and then this one came in through the ear.
Right.
And these are shotgun pellets.
Those are shotgun pellets. That's right. Man. So we'll get a lateral view, so like a side view.
This thing's just been a target for like how many idiots?
At least 3. At least 3.
Is there any way to tell if it's like an old shotgun injury or like newer?
Well,
Like,
yeah,
do we
because
think
we
this is
don't
the
see
same
the-
person.
Yeah.
Actually,
Like
Yeah,
the same
just-
person happening at the same time.
Yep.
I can kind of see where the scars are now that I'm looking for it.
Yeah.
Yeah, so that's all healed.
It looks freckled, like here and there. See those like little freckles? And they kind of line up with the x-ray. So I'm wondering if that's part of the scarring.
Wow. This poor thing.
Oh,
God, why are humans such scum?
Scumbags.
All right, buddy.
Straight on, although we'll bring it over and then.
Is that good?
Should be a little,
He's a little tilted.
maybe if his other arm kind of supports the other side, or I can slide this other issue. Oh, very interesting. Yeah, there's pellets top and bottom.
Oh, wow.
I can crop this so we can.
Oh my god.
So that one, that's the one that's embedded. That one goes real deep. I'm guessing it goes lateral to the mandible.
So right now we're setting up for another x-ray. We're gonna try to do another top down and look at his tail too. Since he's got just shot by multiple different things, we wouldn't just check his whole body. We're here, we can do it, you know, and just see if he's got any other wounds from any other projectiles of any other type. And then we're gonna try to anesthetize him, be able to remove the arrowheads. Anesthetizing an animal like this, a reptile, is it is dangerous. There are
Especially
risks,
with head trauma.
especially with head trauma. There's a chance he doesn't come back out of it, you know, but obviously he's not okay right now, so it's a risk we're gonna have to take. But we're just acknowledging that there is absolutely a risk here, you know. He might not survive it, you know, but we're gonna have to try it.
They're using the safest drugs. One of them's reversible, so if anything starts, you know, going downhill, but
And the shotgun pellets, will likely have to stay in. Lead poisoning happens when you try to digest lead, but actual lead in the muscle or in the bone, in his case, is likely not going to cause toxicosis throughout the body. So he'll probably be fine with those and not get lead poisoning from the shock and pellets. If he swallowed them, yes, it's the stomach acid that causes that toxicosis. But he should be fine leaving those in. Put it to you this way, it would be a lot worse to try to take them out and just dig a bunch of more holes inside of them, you know, so, but the arrowhead definitely got to come out.
If we can.
Like
A
this?
little more forward. A little more. Looks pretty good.
That looks pretty good, yeah. Okay. If we can get his arm, yeah.
The other X-ray.
Oh
That one
no.
right there.
That looks like a pellet, like a pellet gun pellet.
Yeah. Alternative, it could be in his stomach. I don't think it is.
Yeah, it looks like a pellet
Yeah.
gun pellet.
But look, these are his lungs. Look beautiful. How black they are.
So that thing. We
This
think
thing
that's
right
a
there.
pellet.
Yeah.
That would be the third
Why?
projectile.
Like, how is this
Definitely.
happening?
The
I-
third
Definitely
type
metal.
of projectile.
Yeah.
Okay.
So I'll go in his left arm first. I'm just gonna go into the muscle.
Dr. Kushnir is now administering some sedatives, and so we're going to try to deeply sedate the alligator. That way we can extract the arrowheads. So those are pain meds he's administering right now.
Yeah, this is the local anesthetic. It's really in there. Do you want to get your Chlorhex spray? Too?
Yep.
This is all just clotted blood. Oh. Yeah, that smells terrible. Buddy. Okay, there's the
End of the shaft.
there's the shaft right there. So it's going caudal medial. So I'm gonna try to.
Just stuck on the ear
Yeah.
flap.
Could be. I think it's embedded there. A little more of the vocal. I'm gonna remove this because this is gonna die anyways. Oh. Thanks.
to put this down so then you can
Yeah.
lay some things on it and around it easier?
You can also put it underneath his head.
Yeah.
So a lot of this dried blood is holding everything in place. Oh, I think I hear something.
Kind of needs to be under him more, but
Yeah. Well, if you need to move him. Yeah, a lot of this blood is just acting as kind of like a sealant. What is that? That was in his head.
Part of the shaft.
Yeah.
oh, plastic.
Yeah, it's the arrow shaft.
There's a little more. Oh.
Was that like fiberglass?
Yeah. There's another one. There's a lot of the fiberglass shards right there. Doesn't smell great. Poor buddy.
So, doesn't smell great. Worried about infection.
Yeah,
And that also would be indicative that it's been in there.
it's been in for at least several days. That's for sure. Yeah, so whenever we found him, because it was yesterday that he was found?
2 days.
2 days ago, yeah. So we've got movement there. And we feel safe doing this because there's no barbs. We're past that ridge, so.
Here it is.
Poor buddy.
Jeez, look at that hole.
Yeah. There's definitely a sharp point to this. Yeah. In, partially out of the shaft.
So this is right into the ear opening.
Yeah. Yeah, you couldn't hit it if you were aiming for it. Somehow that's what's going on here. I'm just getting all the little fiberglass shards out. Poor buddy.
Sorry.
Yeah. Actually, if we could prioritize getting...
I was gonna say, make sure. I just need to flip them up more because this is so dense of their body.
Yeah.
You can't really get.
Yeah, he still has a...
You put one of those
He'll be
gloves.
well.
You want to wear this or? That is crazy. So did that enter in kind of in that post-occipital sinus cavity opening?
It looks like it went just
Somewhat?
cranial to the occipital sinus. Yeah, definitely through bone. Man, that is
Gnarly.
gnarly. Okay, we're gonna soldier on.
You can't see the other one from that.
That's what I'm trying to see. Anyone have a headlamp? He's still got all this fiberglass in here too.
Yeah, I do have a headlamp in the house. Do you want it?
Yeah, you want to grab it? Yeah. Look at those worms.
Some nasty worms.
Yeah, we can definitely deworm them. And I think that's where we have some of the pellets. Those chronic abscesses. Yeah, he's reacting a little bit. Ideal world, we could get someone to secure the maxilla and someone else to secure the mandible. And then I can actually feel what that is in the back of his throat. Because he's not fully down, so I don't really want to put my...
Or you just put a block.
Yeah.
Okay,
So we
yeah.
get
Look in there.
pellets being embedded.
Yeah.
If they burst, would he then possibly swallow them and then cause the
Yeah.
the digestion
Yeah.
issue? Okay.
Yeah, potentially.
Options.
Oh,
Might be your drum right there.
my dude. Yeah, it's like right in the eardrum. So I have to be really careful with what I put in there in terms of cleaner, because whatever we put in there, it's gonna go to his brain. So I'm just gonna do his. Could I get more of the gauze?
Yeah.
Thanks.
100% want to get the nice time.
Giving second chances. That's what we do. For him, it might be a third or fourth chance.
Honestly.
He gave himself the
He's like
second
a
chance.
cat. He has like 9 lives.
That's why it's important to have a vet who's experienced with crocodilians, because a normal
Sure.
vet would just go straight to euthanasia,
Yeah.
not understanding what crocodilians can survive.
Yeah, so all that nastiness. You see how it's yellow and white?
Yeah.
Yeah, that's the discharge. But again, I have to be careful with what cleaners I put in there because his tympanic membrane is ruptured. I'm glad you guys didn't waste time in getting this all together.
Yeah. I woke up at like 7 and started calling people.
Yeah.
I'm so glad. Kim's like, let me ask my vet.
Yeah. I had just woken up
I love it.
and my phone died overnight. So I was like, oh, I'll go plug it in and I'll make some coffee. And then literally right when my phone turned on, I saw Kim's text. I was like,
what you
whoa.
doing today?
Yeah.
I love it.
I was like, well, I'm not working, so.
It worked out.
And it worked out.
So now he's taking out all the little shards of the shaft.
Yep, all these little barbs here. If we leave them in, it's gonna delay the healing. And they can even migrate to different parts of the body. So it's good to get them out now. That way we can get them healed up as fast as possible. Oh, this one's coming right out. Actually, can we turn that light off? Oh, goodness.
Wow.
Wow.
Okay.
Oh my gosh. That's
Poor fella. So it was situated like this. This one also went caudomedial. Oh my gosh.
Do you need light?
No.
Wow. One of the worms.
Yeah,
that's disgusting.
it's really gross.
What kind of worm is
I
that?
don't know.
Kind you don't want in your mouth.
Yeah. Could be a trematode. Some kind of fluke.
Looks like the ones that come out of Python.
Oh, please don't tell me he has long worms.
That's what it looks
Oh,
like.
right.
It kind of does, but I think the
Definitely
pentosomes kind of have the
smells in
black
here.
head to them.
Okay. Yeah. Definitely. So that's one of the reptiles. Instead of like the liquid pus, they tend to make more of the, it's called caseous exudate. It's
We
like
call
that,
it the cheese.
that cheese. Yeah. So
Cheese.
that smells like the cheese. Yeah. It looks like the cheese.
The gator cheese.
So it's probably the cheese. There's a fistula right there too. That's sore.
Oh, there's so many worms right past the
Yeah.
glottis.
Yeah, I think that right there. There's a BB right there. I can feel that one. You know, if we can safely get him on his back, we could take those ones out while he's down. Right there. You guys see it? That's a BB.
Mm-hmm.
I can feel the hardness and the firmness.
Oh my god, there's so many worms.
Yeah. We'll deworm them.
Oh man. Yeah, it's old.
That's old, yeah. Yeah. Or even on his side. If we can get him on his left side. Or if you want to tilt, yeah, we can try that too. Alright. Going into the belly of the beast. That one I definitely feel the BB. You want to feel it?
Yeah. So that's,
Right there.
yeah. You gotta pop it out.
Yeah, I'm just trying to get the point of maximum pressure. Kim, where are your blades?
They're in. Well, I think they might be.
So we're gonna try to get these shotgun pellets out, especially because the location, like we were saying earlier, if they're just in the body, it's not gonna cause lead poisoning, but since these are in his throat area, they may eventually pass and fall into the mouth and then be swallowed, and that can get lead poisoning.
It could have been connecting the two. See that?
Oh wow.
Fistula. Yeah. So there's just a hole there. Yeah, there's a fistula back there. Yeah, but getting him on. Is that one there? I think that one's there on his tongue. Yeah, feels like it. Right there on his tongue, you see it?
Mm-hmm.
It's right below the surface.
How would that even happen? Do you want me to push him from this side?
Maybe. I wonder if maybe we could switch him the other way, so he's facing that way. Since it's on kind of the left side of his tongue. Are we still looking, Kim?
Yeah, I'm not picking it up.
There's that one.
I also want to hear a gator heartbeat.
Yeah, this is what an alligator heartbeat sounds like.
That's pretty cool. All right, so we're gonna go ahead and reverse him. We remove the arrowheads and 2 BBs. Oh my god.
Yep. Little buddy's a fighter. And all these fiberglass shards. And a couple worms.
And there's still more in there
And there's still more.
that we're just not able to get out. But we got the big stuff, so it's
We got the big stuff. We got the
the
stuff
most
that's
important.
most worrisome. Next is we'll pull a little bit of blood just to test his lead levels, just to make sure he doesn't have lead toxicosis. We'll reverse him. We'll get him started on the best antibiotics. We'll do topical wound treatment for those open wounds. And yeah, we'll take it kind of day by day, week by week.
All right, and now
Putting their pinky in there.
and now Kim is gonna stick her fingers
know.
in.
Swamp girl has swamp fingers.
It's a pretty open cavity.
Oh, we think it's a little girl, or just a
I mean, unless.
very
sad
small
boy.
male.
Yeah.
Oh, sorry.
Oh.
Well, I'm gonna go with girl. Yeah.
Look, he's been through a lot, okay?
Yeah, no, that's pretty open.
The female.
I'd say.
Wow.
I mean, you can double check my work, but
And then these pieces here are actually shards from the shaft that were embedded in there. So there's probably still some left too.
oh, I'm attempting to get a little blood, although right now we're probably our heart rate and everything's a little slow from the whole procedure. So we may have to try a different location. It's okay.
And so what are you gonna check?
For lead. So we're gonna see, especially with all the pellets and everything, we want to see if maybe there's a possibility of lead toxicity. So this way here we can double check that, because if it is, that might be something that also needs to be addressed. So, actually, arch your head forward just a little bit for me there, buddy. Ah, get away. Flies. There it is. Perfect.
Well done.
We just need a little bit for this test. So.
That is a pro right there.
Gator blood is not easy to draw.
I feel like it's a little easier than it is like on some of the turtles or snakes. I feel like snakes are the worst.
Yeah, because they're like, I'm gonna hold this.
Yeah, and then of course their tails are so small and thin. But so basically what I do here is I just kind of, it fills up this little capillary tube to where we need it. And then once that fills up, we put it in the reagent. And then from there it goes into the machine, and then about 180 seconds later, we have results. It's almost there. Perfect.
And Dr. Kushnir is readying some fluids.
Yep, I started with giving quite a bit of called LRS, lactated ringer solution. We're gonna add some B complex in there as well, just because she hasn't been eating and she's probably not gonna eat the rest of today.
Oh, I don't think this thing's gonna eat anytime soon. That much stress.
Yeah.
Yeah.
We'll try and set her up for success with keeping her hydrated, keeping her vitamins and minerals up to date. This is the reversal drug. Go into the muscle.
That'll reverse the anesthetic.
Yep, this will reverse one of the anesthetics. The other ones have probably already worn off.
So how quick of a turnaround are we looking at?
Probably within the next 10 minutes.
We want to tape those jaws up.
Yeah. Let's tape the jaws up.
Do you want to pack her little
We're gonna do a little wound pack. We're gonna do a little hydration.
So something we've talked about a bit on my channel is how like you can't just drug alligators normal because there's some reaction.
I think he's already feeling it.
Since they're conscious breathers, if you
Yeah.
just put them completely under, you have to intubate.
Right.
Right. So like, because everybody assumes that they're all drugged all the time, and that's how you're able to be up close with them. You know,
Oh, okay.
like all my hands-on work I do with them. Oh, they're drugged. They're
Right,
drugged,
yeah.
and it's like, no, you don't want to do that because they'll just stop breathing if they
Yep,
go
it's
under.
the dive reflex that they have. Yeah, so there's different schools of thought, you know, with anesthetizing them. You could do deep sedation, which is what we actually achieved. So we didn't fully anesthetize, we deeply sedated, and then we used topical anesthetics to numb up the area. And that's why we didn't get any reaction from him while we were removing those BBs, while we were removing the arrows. So we're just going to be kind of packing as much of this silver sulfidizing cream inside the wound. It'll help prevent the flies from getting in there, but we're also going to put a little bandage and a bonnet, and hopefully she likes her bonnet. Hopefully she appreciates it. This stuff is very safe. And it actually has kind of like a cooling sensation as well.
Safe in regards to being close to the brain.
Yeah.
Yeah, so I was gonna say, because people are gonna ask, how close would you say that one was to her brain cavity? Like,
Close.
I mean, you're
Close.
quarter inch.
Yeah, it's hard
Or
to say
less?
because you know we did go at an angle, so we did go caudal with both of them. So whoever was shooting shot at an angle like this. So it seems like, or even if they came straight down, if it hit the bone of the skull, it shifted.
Okay, so here's my speculation.
Let's hear it.
Again, speculation. The person who shot this animal is also feeding it,
Oh.
because that's all head on approaching. So this alligator is approaching the person, probably on a dock.
His mouth open.
Yep, that would
That's
be
why you get all those in there and everything.
that would be my guess.
We'll be
So
able to confirm that pretty easily if she's not afraid of us and
Yeah.
you know, and starts
Right.
eating.
well, that's what I'm
We'll
saying. I'm saying it
confirm
now
that
as my speculation now, and we'll find out later. But I would say that they were feeding this gator illegally and then also using it for target practice simultaneously. Especially to get hit multiple times
Yeah.
and not develop a fear of humans. So
Yeah, especially from the initial, the pellet wounds.
yeah. So I should have developed fear, but that fear is overridden by food.
Another thing I was thinking, because there's a cluster of the pellets, you know, with a shotgun spray, the farther away you get, the spray is more, you know, the distance
Right.
between the pellets is
Greater.
bigger. And there's so many just right here.
So I think coming off a dock, up
Yeah.
close, coming up because it's been fed. Call me Gator Batman.
Hmm.
Because we're also going to break this guy's knees. If we could find who did this.
I'm a big public shamer. If I found out who did this, they would lose their job.
Good.
They would be shunned in the
Yep.
community.
That's how you make change.
I want this to go as viral as possible so people start speaking up and
Yep.
ratting on each other.
Don't make Gabby mad.
You don't want to be
Well,
on
it's
my
not,
bad
it's,
side.
and this isn't even like cool. You know, it's not, like this isn't a flex.
No. You're killing a 5-foot female alligator.
Right.
It makes you
Oh.
feel like a big man.
We're just going around, touching up all the wounds. Giving it a little paint
Did you see
job.
that one osteoderm back there where it looks like it's sticking out? Like the bone sticking out from the skin? Look at that.
Oh, yeah.
Isn't that strange?
Huh. It's sharp, too.
It's like too sharp.
Doesn't feel inflamed at all, so. And then the, oh, the F ties, good.
Yep, I have stuff.
Cool.
Holes up right there.
Yeah.
Oh, little indentations. I mean, stuff may have ricocheted off of these too.
So that bite mark looks like
This is old.
a cohort, though. Like, that's about the exact same size as this animal is.
Hmm. Oh, you're saying like for the,
Yeah, if you look at the
wounds?
jaw width right here,
Yeah.
yeah, that's like almost
Here.
exactly the same size animal.
Yeah, that and
Hmm. Can you put a finger right?
Yeah.
Yeah, thank you.
What else is weird about this gator is
Okay, we can put it down.
it's got like some nose rub right here, and the teeth are all pretty messed up too. But it doesn't. I'm not saying it was like captive, but
Yeah.
it's definitely weird.
Maybe it's been in some kind of like storm drain or
well, if the
Or
trapper had him for a little
concrete
bit,
reservoir.
then maybe during holding of trapping.
All right, so she just got fluids, some B vitamins, and we are done. So go ahead and ready to put her back. And I cannot thank Kim and Charles and Dr. Kushnir enough, for coming out and helping out. And Kim, they do a ton of rescue rehab work. You guys should definitely check out their page. Give a little shout out to your page and whatnot.
Yeah, swampgirladventures.org. You can go there and check it out. And we have Instagram and Facebook and all those socials. So.
She does snakes, she does gators, she does tortoises,
Tortoises.
turtles,
Yeah,
like
basically.
gators.
Reptiles and
animals.
amphibians of
Yeah,
Florida.
the reptiles that are hit by cars, she puts them back together. She's amazing.
Yeah, she does
So-
amazing work, guys. So definitely check out her page.
And then you have yours. What's yours?
Yep, I'm the Nomad Vet on Instagram. I pretty much travel around the world helping animals where I can, and yeah, finding some of the coolest people around.
Love it.
All right, so go ahead and put her back.
Oh,
She's
she's
moving.
ready.
She's moving.
She's like, I'm ready
Oh,
to go.
she's ready. She's ready. She's a little sleepy.
Yeah, baby.
Right on cue. She's a paid actor.
All right. Poor thing.
Poor thing. This thing has been through so much.
Take it down.
What are you guys doing? You having fun? So we're just showing everybody around, checking out all the animals. Piggies. Not pigs. Can you sit? Good sitting, Daisy. Oh, look at you, Julie. You sitting? Good piggy. Can you sit, Toonie? Good. Good girl, Daisy. Can you sit, Julie? Yeah, you sit. Good girl. Can you sit, Toonie? There you go. Can you sit, Daisy? Can you sit, Julie? Can you sit? There you go. Everywhere. You sit, Toonie? There you go. All over the place, too. Good job. Daisy here's the smartest one by far. There you go. You the smartest pig. You're not a pig. What are you doing? What are you doing? Can you sit, Julie? Can you sit, Toonie? What are you guys doing? Got some trouble? And here are all the little foster piggies. Not babies. How are you guys doing? Jazzy. Oh boy. Hi, Jelly Bean. Oh, we got your blueberry. Hi, Bean. Oh, you being crazy? You being crazy, boy? Have some food, Cheeky. You work so hard. Oh, it's a little rodent block. Here's Harv and Coco munching away too. Oh, look at Poppy. Here's the Patagonian Mara, enjoying their food. Nope. Says, don't touch me. And one of our little Galapagos tortoises. So I just put down some fresh food and water for them too. The largest tortoise species in the world. They're just a little baby. It's about a year old. But imagine this thing getting up just gigantic and over 100 years old. I won't be there to see it, but pretty cool. Right, Hazel. Good. Good girl. Good girl. Good. Yoi's back there going nuts. She is very impatient. She's not a fan of the new system at all. Oh, there you go. Good girl. Good. Good girl. Look at her. She is not happy. So she'll eat the meat out of my hand, but not the fruits or veggies. But she'll eat them. I mean, they will completely lick the bowl clean. There's nothing left. Good. But as far as when it's on my hand, just the meat. Good girl. There you go. And then Shippo's up there. Don't leave your food, buddy. Oh, checking out the water refill bottle. It's a very threatening foe. Hi, Kira. Good. Good girl. There you go. Good. Good girl. Kira. Good girl. Kira. Good girl. There we go. There's a big piece. Good. Good girl, Kira. She's very happy. Come here. Kira. Good girl. Kira. Good girl. There we go. There's Yue eating hers. We've got our worker guys over there working on the new enclosure, so she's a little nervous. Look at this mess from these coatis. Just knocked down all their hides and houses and pooped everywhere. So, time to clean the poop. You taking a bath? Isn't that nice? You like that? And the small parrot aviary right now, so we just gave them a bunch of millet, which they're very excited about. That's their favorite thing. There you go, some pepper. Oh, there you go, Chad. So he's got his rabbit grinds and some pepper and apple. We've got some thunder in the distance. Really hope it rains. We really need the rain out here. Hopefully we get some tonight. All right, Olaf, time to go inside. Get your meds. We'll go ahead and end the video. Say bye-bye. 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 No, not gonna say it today. Sadly, once we came to check on Archer in the morning, she had passed. Unfortunately, even after all the effort, we tried everything we could, she did not make it. And Kim said that after she ran the blood, she diluted it 3 times and the lead levels were still off the charts for her equipment. So we're thinking that lead toxicosis is probably what actually ended up causing death. Obviously, the stress of everything involved as well, but the lead was probably a huge factor. and that would likely be, well, whether or not she ate something with lead or having the pellets end up in her stomach from migrating through the tongue and the top of the skull like we were showing before. At least she got to pass with dignity and calmness. You know, she was sedated, so we would like to think that she passed very peacefully, very calmly. Obviously, this is not the ideal situation. This is not the outcome that we were hoping for, but we knew it was a very, very real possibility. And it's just a miracle that this alligator survived as long as it did. I mean, it was shot with multiple arrows, with a shotgun, and then possibly with a pellet gun or 22. We had one of our friends who's a former police officer check out the x-ray as well, and he said that he thought one of what we thought might have been a pellet was actually a 22. And he also verified that those were from a shotgun all across her face too. So just so horrific and so sad. You know, this animal did not deserve this. And this is the downside of working in rescue. You know, we've gotten lucky with quite a few success stories, but obviously they're not all going to be success stories. This is what happens when you work in rescue. You're working with animals that are already dying, and some of them do end up dying on you. And it's just really, really sad. Not only am I sad, I'm really pissed off. I mean, this is an alligator that was maybe 5 feet at best. It weighed 27 pounds. It was not a threat to literally anyone. No one shot this animal in self-defense. It's also, again, 27 pounds. No one shot this animal to try to eat it. They weren't trying to kill it for any purpose. They were using it as target practice. And I've known guys like this growing up in Central Florida, high school, that kind of thing. I mean, you get a lot of young guys, they get a brand new gun or a new crossbow or whatever. They just shoot anything and everything that moves. It's just target practice. They just blast anything without thinking about it and just torture poor innocent animals like this. This is not, again, we're not against people hunting to feed themselves. No one is doing that here. This animal very clearly was used as target practice by a very sick individual. And so we just want to put it out there, guys, that if you know anybody who's doing that, if you see anybody doing that, shooting at wildlife in general, please call the police. You call the police, you can report them to Fish and Wildlife, anything like that. But, you know, people like this need to be stopped. And it's just so tragic. No animal deserves this. No animal deserves to be shot with multiple projectiles just for quote unquote fun for somebody. It's so sad and horrific and just makes me ashamed of people that they would act like this. Anyways, though, we did everything that we could. I don't even know what else to say. I'm obviously very upset about this. And, you know, we were hoping for the best, but this is what happens sometimes when you're working in rescue. Either way, guys, I just want to say thank you so much for the support. We had a huge amount of support for this alligator. We got a ton of donations in across Facebook and Instagram and on our website. So thank you so much to everybody who donated. And that money will be going towards other animals in the sanctuary. That stays all in the nonprofit account. So that'll be used for further nonprofit activities, probably vet bills. That's usually our biggest expense that we have to go with. So thank you so much to the huge amount of support that we did get. And, you know, sorry that we lost this one, but we will continue trying. We'll do our best. And, you know, it is what it is. And we'll just try to do our best to save as many as we can. And, of course, there will be losses along the way. So thank you so much, everybody.